Hello, everybody. Welcome to our MPA community. We are extremely excited to be welcoming four very distinguished MPA current parents from the medical community who are going to be helping us with a number of COVID-19 related questions and answers. They're going to be covering a lot of topics tonight. So we're really excited to jump right in and get going. But first, I'm Jennifer Rogers. I'm the Director of Development and Community Engagement at Mounds Park Academy. I have the great honor and privilege of working with many of these wonderful individuals on our MPA COVID advisory group and call on them quite often as we have planned for and executed our school COVID response. So tonight, I'm going to really kind of break it down for us of how we're going to jump right in. First, just introducing all of our amazing panelists who are going to kick things off by answering some pre-selected questions that we have for you based on feedback from other MPA community members on those hot topics right now related to COVID. They're going to do their best to work through those questions, but most importantly, saving time to answer any questions of those of you who are watching live that you have burning in the back of your mind. This is really your chance to put those questions out there related to all things COVID with school, your children, how it impacts your families. So thank you so much for joining us. And again, I just want to welcome, first of all, Dr. Emily Binstadt, who is an emergency physician with 22 years of clinical experience. She's at Regents Hospital in St. Paul and Brigham and Women's Hospital in Boston. There, I got that out, Emily. She's a graduate of the Mayo Medical School and the Harvard-affiliated Emergency Medicine Residency. She also has her master's in public health from the T.H. Chan Harvard School of Public Health and completed a fellowship in health professional education and simulation technology at Harvard Medical School. She has many areas of interest, but I'm most excited to, of course, remind everybody Emily is a proud MPA alumnus and also has two current students in the MPA upper school. We also have Dr. Bryce Binstadt, who is joining us. Yes, folks, they are related. For anybody who doesn't know, Emily and Bryce share those two daughters and are happily married. Bryce is an associate professor of pediatrics in the Division of Pediatric Rheumatology, Allergy, and Immunology, and a distinguished university teaching professor. He cares for children with arthritis and many other rheumatological disorders. Bryce, I'm skipping over some of those to make sure I don't stumble over my words. I hope that's okay. He also heads a laboratory in the University of Minnesota's Center for Immunology, focused on understanding the pathogenesis of autoimmune diseases, with particular emphasis in immune-related cardiovascular disease. Again, so excited that Bryce and Emily have their two daughters in the upper school. We also have Dr. John Faust, who grew up in Rochester, right here in Minnesota, graduated from the University of Minnesota Medical School in 2006, and completed his residency training in anesthesiology at the Mayo Clinic in Rochester in 2010. He completed his board certification in anesthesiology in 2011, and since then, John had joined a practice that provides anesthesia services at several Allina Health hospitals. And most sort of special for me, because I've called on John many times, as over the last 18 months, he's been involved in a lot of COVID-19 planning at local hospitals and in the Allina system of 12 hospitals. John and his wife, Dr. Jessie Flynn, have 3 MPA kiddos, 1 in the middle school and 2 in the lower school. And finally, we have Dr. Courtney Herring, who has been with Children's Minnesota since 2015 as a hospitalist at both Minneapolis and St. Paul campuses. She's been a part of departmental and organizational-wide quality initiatives surrounding vascular access and utilization. She also has completed a Master of Healthcare Administration from the University of Minnesota and has many responsibilities of a medical surgical director at the St. Paul campus since June of 2019. Courtney, of course, and her husband Josh also have 2 MPA children, and I'm so excited to learn from all 4 of you tonight, and again to get all of our audience members questions answered. So, wanting to jump right in here, we're going to kind of kick things off here with Bryce. I would love for you to share first, based on what you're seeing in your own professional world. What would you talk about when you think about the current state of the pandemic? Is there information that's super timely right now that you want MPA parents and community members to know as we continue to combat COVID-19?
Sure. Thanks, Jennifer, and welcome everyone to the webinar. So I'm a pediatrician, and so I'm interfacing with children in the hospital all the time. And I would say that the COVID is still here. It is, it's moving from being a pandemic to being an endemic disease that we're going to have to figure out how to live with and move forward. And with several, the age range of children still being ineligible for vaccines, we're hoping that will change. We're still seeing a fair number of children hospitalized with COVID infection. Earlier in the course of the pandemic, we were seeing much more multi-system inflammatory syndrome in children, or MISCI, which is a severe complication of COVID. And that's we still see patients with that, but we're also seeing pediatric patients with more standard COVID, similar to what adults have, and that's being attributed to the emergence of the Delta variant. And so it's still out there in the community, and kids are unfortunately getting sick and getting hospitalized. And so that's what I see in my practice.
Thank you for sharing that. I know that that's probably not something any of us want to be hearing, but really important information for us to have. Emily, how about you? Kind of same question. What would you share that's the latest that you're seeing in your practices right now?
Well, thank you, Jennifer, for having all of us here and for hosting this event. And I hope it's useful for everyone watching. I guess the things that I would just point out is that our healthcare systems are under a lot of stress right now. It's a combination of the resurgence of COVID, as well as nursing shortages that are prevalent currently. And it's leading to a lot of delays in getting patients from the emergency department where I work up into inpatient beds, which is having a ricochet effect on multiple areas of healthcare. Additionally, just the fact that people in the emergency department for various reasons, even if they don't have COVID themselves, are having to wait longer periods of time, both to be seen in the emergency department and to get a bed in the hospital. So we're under a lot of stress. I would also say that, kind of just to reiterate what Bryce mentioned about kids getting sick, young adults, I don't see as many kids as the pediatricians do, but young, healthy adults are getting sick and having catastrophic consequences from this disease. It's real. Most of the time, people do well, but unfortunately, there's no way to predict who isn't going to do well. Obviously, you're at increased risk when you have multiple comorbidities, but it's not like anyone's safe. So if you want to hear my horror stories, you can talk to me personally. I don't think I necessarily need to air them here, but it's real. I think the other thing is that we're continuing to see a lot of misinformation and people that are just generally confused. And I think it's hard in this environment sometimes, when we're trying to get our news and information from all different sources, to know who to trust and what to trust. And this pandemic has made that prevalent or an issue on a whole nother level than anything we've probably ever seen before. And so that's why I really applaud MPA for putting this together, because I think hopefully it's an opportunity to ask questions straight to the faces of people that you're going to have to, interact with later. You can grab me in a hallway if we're ever back in the hallways and, ask me COVID questions whenever you want. But hopefully it's a chance for some just honest interaction. So I'm looking forward to questions.
Thank you. Thanks, Emily. So John, I'd love to turn to you next. What would you like to share, as far as what you're seeing right now?
Thank you very much, Jennifer. So like Emily, I care mostly for adults. And in our hospitals, as in hospitals across the country, I think what we know is that the majority of the patients we're seeing hospitalized for COVID-19 are unvaccinated. I think that it's easy to lose sight of that when breakthrough infections and boosters are in the news, but really the strain on the healthcare system is really coming from unvaccinated populations. The state just released data that the average age of a hospitalized patient last winter was 65, and now that's 50 since the summer. So these are younger people who should be lower risk, and who, most of these people, we could prevent this disease with vaccination. So I think that's hard for us to see. It's a big challenge. Emily talked about the delays in the emergency room. We're actually calling patients now and telling them we can't do your operation that we had planned. We'll have to reschedule that in a few months when things are better, because we don't have enough hospital beds and nurses and staff to take care of all the things that we can't delay. So we're really, really seeing that impact in our hospitals.
Well, thanks, John. I appreciate you sharing that. And Courtney, I'd love to turn it over to you here to round out this question. What's the latest for you and what you're seeing?
Yeah, so I actually work with almost all children. I will say in the pandemic, we actually take up to 30-year-olds at Children's Minnesota to help out with offloading the crisis that are happening across, our state in the adult side. However, I will echo really what all the panel has said. We're currently in a state in the pediatrics system, which is completely different than last summer, where we are having some of the same issues as the adult hospitals. We have extreme patient volumes, we have crisis staffing, and we have non-COVID infectious admissions that has, really been because we've reduced our social mitigation strategy. So open society up in essence. And children are harbingers for germs. They're lovely and they're the best part of our society, but they also love to share, not just their toys. And so this is what we're seeing in our hospitals. And I was lamenting before we even got on our call today with the quorum we've got, and it just said that I start tomorrow for a run of days, and we already have 21 patients in our emergency department that need an inpatient bed that does not have one available. And so we are seeing a whole different world this summer in the pediatric healthcare systems than we have been typically through this pandemic. I want to just kind of add a little piece to that. COVID is definitely alive and well in pediatrics. We're in the nationwide, we're seeing about 5 times the admissions just between June and August of this summer. And that's, being reflected somewhat in our own healthcare systems here across the cities in pediatric need for hospitalizations. And that definitely is much more of the acute COVID symptoms, as Bryce alluded to, and not as much as the inflammatory process we see after the infection, which is that MISC or multi-inflammatory syndrome in children. But I want to put a plug in that we are seeing other things that are very vital to the continuity of care in the pediatric world. So what we're seeing heavily are things that are atypical for summer, but not atypical for pediatric care. Things like that are viral, a lot of viral respiratory pathogens. They are everywhere with the runny noses and the coughing. And a lot of those young people need a hospital to help them get supported through those diseases. So one thing you'll hear in the news is RSV, so respiratory syncytial virus. It is our manna all winter. However, our winter has come quite early. So no, it is not Game of Thrones here, but man, there are days it feels like it, that we are in a battle every day to get through the winter that has come and probably will last for several months. And so a plug that we are now seeing influenza in the community. So for all of you out there who have graciously invested your time and efforts of learning about the COVID vaccine, don't forget your influenza vaccine, because it is already out there. We're seeing it in our emergency department at Children's. So go ahead and make your appointment at your local CVS or your local pediatric office to get that situated, because it's a coming. So thank you for your time and thanks for being here. Happy to answer questions.
Thank you so much, Courtney. And, I would be remiss, I'm sure there's many who are watching right now. And I feel like I need to just on behalf of our entire community, the Twin Cities area, to just say thank you to each of you, because this has been a long haul in many ways. And for those of us who are not in the medical profession, I can just only imagine what all of this has been for all of you. So truly, thank you. We just can't say that enough. And Courtney, I actually just want to kind of pop it back over to you here and shift and talk about vaccinations. I want to hear from all of you about vaccines, but it really is kind of the hot topic right now. Of course, at MPA, we are super proud that we have 97% of eligible students fully vaccinated, 98% of adults in the building, our employees fully vaccinated, which is phenomenal. But I'm just curious, are there any myths out there that you've been hearing about vaccines that you want to try to dispel, or anything you want to share?
Oh, Jennifer, it's like loading it up and getting ready. So myths, of course there are myths. Like how have we you can't even go to your grocery store without hearing about a myth, whether it's on the front page of a magazine or just in the grocery line with a neighbor. So I would say a couple of things that just to make note of. We are so lucky to be able to call out our vaccination rate at this level that we're at 97, 98%. That is, I mean, it's glorious. And I thank all of you for that investment, and not only in trying to learn more about this pandemic and learn about COVID, the virus, and what we can do to mitigate it, but also the buy-in that we're trying to keep your children safe. We're trying to keep us safe, trying to keep everyone in our homes and our neighbors alike as healthy as possible. And regardless of that, in the first part of this month in September, the American Academy of Pediatrics did publish kind of regarding where we're at about eligible adolescents and vaccination rates. And just for us to know, across the country, only about 45% of eligible adolescents have been fully vaccinated, which means completed the 2 vaccine series. And I think that's a daunting number. And I think we have to take heart. There's a lot of good things coming out of it. But that's why I say congratulations to us. Congratulations to all of you on the line who are, once again, still investing in learning more about this pandemic and COVID, the virus. Myths. Okay, all I will tell you is, I don't want to call them myths. I just want to say it's misinformation. Okay, it's misinformation. It is taking parts of things and trying to extrapolate without true science. I want to hit hard on our part of our adolescent population about fertility. I think fertility is a hot topic. It has been for a long time. And just know that in my mind, no, I do not. I am not an OBGYN. I do not take care of young people who are pregnant. However, I take care of a lot of adolescent females and a lot of adolescent males who have really good questions, and parents who have really good questions about the COVID vaccine and fertility. There is no biological plausibility in my mind that it has any downstream effect. And part of it is actually the way we are, and then what we're using in this vaccine, which is this mRNA type vaccine, which is not novel per se, but it is something that's newer to us about hearing it in the news as we have over the last year. Just know that in general, this breaks down in the body. It's delivering information to our body to tell our immune system to identify the virus, fight against the virus, and build up our immune system. But beyond that, the actual vector, what it's being carried by, degrades very quickly in the body. It doesn't affect anything downstream outside of delivering what we need it to deliver, which is the parts of the virus of COVID-19. So I'll say for me, that's such a big deal because it's an important topic, and I want people to feel safe when they are being able, one, to safely ask the question to your providers or your friends and neighbors like us who are on the phone, but also to say that I can tell you at this point that you have 2 bodies of science behind it. You have the American College of Obstetricians and Gynecologists, or ACOG, and then you also have the Society of Maternal Fetal Medicine, who are both recommending strongly for vaccines for pregnant people. So I just say that lovingly, that it's not just coming from a pediatric standpoint. This is very well touted by the people who know women's health best. So I'll say that.
Thank you, Courtney. What an important topic. And I want to shift over to you, Emily, and again, kind of ask you that same question. Is there anything that you just really want people to know about vaccines, or what's the most important piece of information for them?
So I think the biggest take home is that the vaccines work. Full stop, period, end of story. I think that sometimes amidst all the other things that people are trying to suggest maybe we don't know enough about, we're losing sight of the fact that the vaccine has been administered now worldwide to billions of people, and the side effects are vanishingly low, and the effectiveness is impressively wonderful, like probably beyond anything we could have imagined, right? So I think that's the thing to keep in the front of your mind. And then regarding anything as far as specific questions that people have, I will say that I think that there is some degree of fatigue within the medical world right now with this endless array of myths and, concerns. That being said, I think all of us have kind of gotten to the point where we're like, ugh, and then we move on to, okay, people, let's answer your questions. So I hope that you guys see this as a friendly and welcoming spot to ask any question, even if, you might be thinking it's a dumb question. It's not. We're happy to answer it. Trust me, I've heard everything. Because I actually make a point of asking my patients that aren't vaccinated why. And so, yeah, I will be surprised if I haven't actually heard already someone already asking me the question. So you probably aren't going to shock me by anything you might ask. So bottom line, it works. There's some specifics that we could get into, but I think for now I'll leave it at that.
Well, and you just did a great plug there, right, to remind people that they can certainly post their own question in the comments, and then we'll make sure to get to those here at the end while we still have all of you. So, Bryce, I want to turn it over to you now. What do you think about vaccines? What do you want people to hear on that topic?
Oh, I would echo what both Emily and Courtney have said. They work. I am anxiously awaiting the FDA authorization for use of the vaccine in 5 to 12-year-olds. I think that could happen as soon as the end of October, and that will be huge for the reason that Courtney talked about previously, which is that kids in that age group, even if they're not symptomatic, may be spreading the virus around to other children, to adults, to at-risk adults, their grandparents that they're living with, and so. Even though children, for the most part, who get COVID tend to fare well in terms of outcomes, they are the vectors that are spreading the disease around. And so for the entire population to get through the pandemic and return to normalcy, vaccinating as much of the population as we can is going to be essential. I think that the vaccine, based on what I've heard, the Pfizer vaccine in children is going to be safe. If my children are beyond that age group, they've both been vaccinated because they're 12 and older. But if they were in the 5 to 12 age group, I would be lining up first in line once that vaccine is authorized by the FDA. And the same applies to unvaccinated adults who are still eligible but have not been vaccinated. Even if you think you're at low risk of becoming symptomatic with an infection, do your part, help out the population and reduce the spread through the community by getting vaccinated.
So, Bryce, before we hear from John on this topic, I just want to actually ask you a question that we just got as a comment. So, curious about what kind of protection a kiddo who is not eligible yet, might have from a previous COVID infection. Is that something that can help parents to navigate some of this while they're waiting for the vaccine? What does that look like for families who have had that infection go through?
Yeah, so it's a great question. And so for individuals who have been infected, they likely do have some immunity. Even for those individuals, the vaccine is still recommended because the vaccine will boost the level of immunity and offer greater protection. And so if I were in that category of having had COVID but not been vaccinated, I would still be very, very cautious in terms of mask wearing, distancing, hand hygiene, all of the things that help prevent transmission. If I were vaccine eligible, of course, I would go out and get vaccinated. But the vaccine is still recommended for people who have had COVID infection, symptomatic or asymptomatic.
Wonderful. Thanks for getting to that question. And again, to anybody out there in the audience, feel free to keep those coming through and we'll sprinkle them throughout or save them for the end. So John, I want to kind of turn it over to you now to talk a little bit about just vaccine boosters and maybe even what you're hearing about availability for kiddos that are under 12 when that vaccine might be coming up on the docket for them.
Yeah, I think I would echo what Bryce said about the 5 to 12, and I think what people are starting to say is end of October is a time frame where that authorization may happen. So sometime at the very end of October or early November. So And Bryce, I'll be there in line with my 5 to 12-year-old kids for sure. They're definitely ready, and they're asking when they can get it because they know that will help get us all back to normal, right? Or more normal. We could talk about boosters. I actually, Jennifer, had a little point to make, I think, about sort of questions about the vaccine, or maybe in the myth category, because I think those things go together. It sort of follows on what Emily said. I think when they first announced, when they were talking about vaccines, I think they had an efficacy rate of 50 or 60% that they were saying would be successful, and they would approve a vaccine at 50% efficacy. And I think everybody was surprised by the efficacy rates that we had with these vaccines, effectiveness of 95% in the studies. So we're very fortunate to have these wonderful tools and to have them been developed so quickly. Now we're in a situation because of the length of time since we've vaccinated, especially our high-risk people, and because of possibly a contribution of the Delta variant and how much COVID there is out there, for sort of some combination of these factors, we're seeing more of these breakthrough cases. So infections in people that are vaccinated. And I think for some that came as a surprise, because we just weren't hearing much about that early on, sort of earlier in the vaccination timeframe. I think maybe to Bryce, if maybe it wasn't a surprise, because he has studied stuff probably more than any of the rest of us. He knows how vaccines normally work, and a vaccine that you put into your arm normally will not completely prevent infections that you inhale through your nose and through your nose and mouth. So what we're seeing with these breakthrough infections is that they're typically mild, especially in relatively healthy people, and that they're short-lived. But it's sort of something that sort of has been anticipated. We didn't anticipate that the vaccines would completely prevent infections. We sort of anticipated that this would occur. It plays into that booster conversation, which I think we could get into maybe later if there are more specific questions, or if we want to go down that road. It gets a little complicated, but the CDC has a few groups of people in which they are recommending boosters. You should get a booster if you're in one of those categories. And then there's another several groups of people who it's more a consideration. So you may get one considering the risks and benefits of that. Especially for those higher risk people in which they're recommending that people should get them. Those are older people or people with complex medical conditions. Those are the folks in which we see the waning, in which we see the breakthrough infections being more of a concern, more of a health concern. So we're trying to offer the best protection to those people that we can.
That's all really helpful, everybody. Thank you. And I'm sure we're all just kind of waiting with bated breath for that big announcement that we all are hoping are coming. I know, especially at the school, that's something that we talk about a lot, and how we can support families once we reach that milestone. But in the here and now, Emily, I would love to kind of turn it back to you and just talk a little bit about symptoms and symptoms response, right? When I get families to reach out, oftentimes they say, well, my kiddo doesn't have a fever, or, I don't have a fever, but here's what I'm having. What would you say to families about symptom monitoring and its importance right now as we continue on in the pandemic? I might let you get unmuted there, Emily, first, and then we'll start over. There you go.
Thanks for that. I think it's a challenge, especially for parents of younger kids who may not have tons of symptoms. There's pretty good data that there are a lot of kids that are asymptomatic that are spreading COVID, and or they are mildly symptomatic. So I don't see, again, as many kids. So I'm happy to defer to Bryce and Courtney on the further what they're seeing clinically with that. I can tell you though that certainly even in the unvaccinated adult population, which should have the absolutely classic COVID symptoms of cough and fever. Not everyone's COVID. Read the book on that. There is a wide variety of presentations of COVID, including asymptomatic. We're testing people who are going to go see people like John in the operating room. And often that's how we'll discover that they have COVID and they didn't have any symptoms at all. So just, I guess the take home from this is any sort of GI upset, generalized fatigue, obviously shortness of breath and fever and cough, but diarrhea, nausea, anything really can be COVID almost. And so I would say, if your kid is just not acting right, get a test.
Good advice. I do want to just give, either Courtney or Bryce the opportunity if you want to jump in. Anything you would add on the symptom piece here?
Courtney sort of talked about this before, but with sort of our usual cough and cold season coming up, it's going to get even more confusing. And so mask wearing will prevent transmission, not just of COVID, but of all other respiratory viruses as well. So that can make things less confusing. Getting a flu shot, like Courtney mentioned, can make things less confusing. You don't want your child getting influenza. When they show up in Emily's emergency department, they're going to get tested for a whole bunch of respiratory viruses, including COVID. But doing the other things that reduce transmission of COVID will also help with all of these other things. So keep up that work.
That's actually a kind of a good segue, Bryce. I might let you stay on that point for just a minute. So I'm curious, outside of school, right? I mean, we have all of these mitigation strategies that we're doing inside the school building, but what do you hope parents are doing with their kids right now to kind of prevent, or maybe things to do, to not do, right, to prevent transmission for their kids, especially as they're coming to campus every day?
Yeah, I hope they're using common sense. Meaning if your child has symptoms like Emily was just talking about that could be consistent with COVID, which there's a wide variety as she just described, get them tested. It's not just for your child's sake, it's for the sake of the entire community, for the entire population. And so you're doing public good by getting your child tested and keeping them away from others until you are sure they're not carrying COVID. Obviously we all have to live our lives outside of school and work, and people make decisions for their own families. I would say if you are around elderly individuals in your family, you have to be especially cautious. Encourage those people to get booster vaccines that they're eligible for, and the practices that we're doing, as I've mentioned, the mask wearing, hand hygiene, and distancing do actually work. So, and they've again, they work not just for COVID, but all these other viruses. So keep it up, make decisions that make sense for your family, and recognize that it's not just about your child and your family, it's about the entire community.
Very wise words. Yes, Courtney, I echo that little love symbol right there. I love that as well. And of course, I would be remiss as our COVID health and safety lead if I did not remind people who have current students at MPA that might be listening that we do have on-site testing available now, right? Which we just rolled out this week, which is wonderful. And so, of course, you can email covid@moundsparkacademy.org to learn more about that. If your kiddo is symptomatic, was exposed, or if they're unvaccinated and you want them to start getting regular testing at school. So John, I would love to kind of shift over to you now and actually talk about some of those mitigation strategies that MPA has been using for quite a while. Somebody who has been helping us with planning, and I know we talk a lot about things we're doing, what we're getting right, maybe things we could be doing better. What are some things that you feel like are really working well for us on campus right now?
Well, I wanted to follow up on Bryce with my favorite mitigation strategy, as you know, Jennifer, which is ventilation, something I probably email you about once every month or every 2 months. I think that it kind of took the medical community quite a while to figure out how important ventilation is in terms of prevention of COVID transmission. The idea is that can float around in these tiny particles. It can float around a room. So the idea of as long as I'm 6 feet away from somebody, I'm safe. That's not really true anymore. The best ventilation that you can get is outside. So I think that's what we've been doing as a family in our own. That's often our choice if we can do that. If we're going to socialize, we like to socialize outside, and we'll see how well we can keep that going in the winter. Right? It makes it a little bit harder, but things you can do to enhance ventilation in the winter: open a window, for example. So MPA has ventilation above the standard, above that. I think the ventilation, Jennifer, is 2 to 3 air exchanges per hour, which is above the standard, which really helps. And you guys we're using the outdoor spaces as well as we can while the weather allows, which is really great to prevent transmission. Ventilation is probably my favorite strategy just because it's sort of underappreciated. So I like the underdog, but vaccination is the most important strategy for sure. So kudos to the teachers and staff and the community for doing such a great job. So what that does is not just protect those individuals that have chosen to do that, and it's those children, but it protects the kids who are ineligible in the building, and it protects the people in the building who have chosen to get vaccinated but aren't going to mount a good response, like people that are immune compromised or older. They don't mount as good of an immune response, and so they don't get as good a protection from the vaccine. The testing, I think, is great, and hopefully we can talk more about that. Jennifer, I was really excited to hear the announcement of the surveillance testing program. And so because of the point that Emily made earlier, a kid with COVID or a person with COVID can have any number of symptoms or no symptoms at all. And that's why surveillance testing is a really good strategy to try to identify cases, and so that we can pull those kids out of school, prevent transmission from those kids or adults, and keep the rest of the folks in the community in the building, which is what we all want to do safely. And I think that the mask use on campus is just so great. I think I like the way that we have sort of brought the adults into that, even when we're outside. I think having everybody have a mask on anytime they're on campus just really normalizes it, makes it part of the deal. And I think we've learned that our kids do just fine wearing masks as long as the adults around them kind of do okay wearing them. Kids tend to kind of mirror what they see the adults in their life doing. And then I think I wanted to just mention the symptom screening too. I think the daily symptom screening, so having people thinking every morning about how is my child feeling, or having the older kids think about how they're feeling and checking that temperature, it just sort of gets us in the mode of, thinking about that. Oh, wait, do I have a little bit of a scratchy throat here or a runny nose? Okay, I've got to click this box. And I know it's a lot of work for you guys to follow up on those, but it's a nice mitigation layer that we're using.
I love it. Thank you, John. I appreciate all of those, highlights of things we've been focusing on. And there was one in there that I know is a really great segue to what I wanted to actually ask Courtney about next, which was masking. So what would you want parents to know about masking? Do you have tips, any props, maybe anything that you want to help us to think through masking as we continue on in the pandemic?
For sure. I mean, what good webinar would not be a webinar without a demonstration, right? I mean, that's what you probably have all jumped on the line for. So I wanted to say, for John's points, who covered so many things, can I say, welcome to being an anesthesiologist, ventilation. Oh my gosh, that's his daily jam. So I'm glad he points it out, because it's definitely reaching a scientific level that we all should appreciate. I will also say, for mask mandates in school, they work. They literally 2 days ago just published 3 separate studies that followed public schools in different parts of the country, some specific to the state of Arizona, but actually some in different pockets of the area that they accumulated nationwide data. And I just want to say that the data is showing schools that started with mask mandates are having extremely low outbreaks in those schools and very much different in comparison to schools who do not have a mask mandate. And so if you have any questions or if you want any more information, I have all these studies kind of piled into a folder. But just know that once again, thanks for the buy-in. Like, it is helping, it is working, and we're now starting to see the results of that. So, and we're seeing it nationwide. So again, wonderful, awesome. Thank you. So mask, oh my gosh, who doesn't like a good mask, man? That's been the new fashion of 2020, 2021. I mean, my stocking stuffers was basically glitter masks. So I'm sure everyone felt the same. Cheek. So just know that for masks, John actually brought up a nice point in a brief quorum about, they need to fit and they need to be comfortable so people will actually wear them. And that is like hands down, I would say probably the one-liner of all masks. They fit right and they're comfortable and you can wear them all day. Just know that, like what masks are going to help us with, seems pretty straightforward. It's like being the kids in the line going to the cafeteria. You keep your hands to yourself, right? To not cause problems. Well, we're keeping our emissions to ourselves by putting our mask over our face. So this is really like we've been doing these kind of things for different reasons. It's just comes with extra fabric. But hopefully you can think of it a little bit that way. So mainly is the fit. You want to make sure it fits snugly right across your face. And it, yes, needs to cover the nose, the mouth, and under the chin. And that's because if we only breathe out of one hole, it would be a lot less trouble in a pandemic, but we don't. But because of that, we've got to make sure we're covering everything. And anyone who's ridden a plane, and I don't raise your hands because I know some people don't want to admit it. I have. And I am the first one to be like, sir, you have 2 holes right here. Please cover them. So I think once again, there is a reason we say that the fit does matter. So not only that, you pick one. So for us, the surgical masks that we think of, like the disposable masks, they come in multi-layers. They're already plied. But when we think of fabric masks, they aren't all created equally, as we probably have found for ourselves by, hits or misses on Etsy or Amazon or wherever. So the main thing is, like, I do recommend fabric masks that have 3 minimum layers. And one is because the most innermost is the absorbent layer. That's really what's helping us. I would hate to say spittle. My Mima would hate that, but that's really what it is. You're trying to keep that to yourself. And so that absorbent layer needs to be there. Some of the more double layered masks don't have the same absorbent material. And so that's actually one thing you're lacking in those masks. The middle layer is kind of a non-woven, non-absorbent. It's kind of just a sticking point, almost like a holding place to give you an extra barrier. And then the outside layer can be anything from polyester. You want to do something that's not vinyl based, harder to wash. And that really leads into hygiene around masks. Not only should you wash your hands, just any time you're using your mask, to put on and even to take off is preferable. Trying not to touch your mask too frequently. But you also, in cloth mask world, you do need to wash them daily. It is not something you want to reuse because even though it's an absorbent mask, it's an absorbent mask. You need to once again, clean them to reuse them. And so you can use them once a day, but if they get soiled or wet, that's also another reason that you would need to change your mask. And that's pretty common even in the hospital for us. Even if you have your surgical disposable mask, if they get wet or they get soiled with something, you want to toss them and replace with a new mask. And so the other things are, a couple of tidbits that I had to learn over the last several months because I've been guilty of this. Do not figure 8 your ear masks, okay? Your ear loops should not figure 8, okay? And then put them over here for a tighter fit. It's a great idea, theoretically. You are trying to pull it closer to your face, but what you are doing is you're gaping on the side. And so your emissions go to the lowest resistance. So they will come out the side. And so there is a really cool technique. I did not invent this. The CDC has a nice little video on it, and it's actually called the knot and tuck. I'm sure there could be a TikTok about this somewhere. So I'm going to demonstrate the knot and tuck. Please feel free to laugh all you'd like. It's all silent for me. So I have a basic surgical mask. Hopefully you can see this. You're going to fold it in half, just like that. You're going to take each loop and you're going to tie a knot. and try to make the knot tie as close to the mask as possible. And I do this like I'm doing a great job here. So I come in, and I want to pull this down as tight as I can, like that. Do the same thing on the other side. I'm right-handed, obviously not ambidextrous. So we will turn it around. Same thing, you pull it, try to get as tight as you can on that side. There you go, you have 2 knots. You're not done. So you come up, you pop it open, and you actually are going to fold and tuck. And that is your tuck piece, okay? You fold and tuck. Do it to the other side, fold and tuck. All right, let's see if I did it right. You pull it up, you have your mask. You want to get it tight on your right across your nasal bridge and right across your cheeks. You're going to pull your strap. Here you go. It's a tighter fit around my big old earrings. And there you have a tighter fit. Can you pull it across your back? I know, it's a little, sorry it's so light, but that is a tight fit that also blocks the gape. And so that is your new reference. It's your 2021 version of your figure 8. So that is a way to make things a little bit more fitted even for your disposable. And then for eco-friendly, if you are using disposable masks, cut your ear loops before you throw them away. The turtles will bless you, okay? For John's point, he actually had talked about KN95s for children. There are KN95s. There is nothing special about KN95s other than to say they are closer. Well, they're special in regard to beyond the surgical mask. They're better than surgical masks. The point of why they're called KN95s is that in general, we think of them filtering up to 95% of particulates. So basically respiratory pieces. So it's the equivalent for the states of N95s, which you've heard a ton about throughout the pandemic for healthcare workers. The United States, the FDA did have an emergency use authorization of KN95s throughout the pandemic to ensure that healthcare workers and other people at risk had availability for these type of masks. There is nothing different really between a KN95 and an N95. It's just that in general, KN95s are more used in other parts of the world like we use N95s. So China, mainland China, uses KN95s like we use N95s. So don't be worried that there's not an FDA approval anymore on that, because that was kind of taken back over the summer when we had plenty of protective gear now in the United States being produced and shipped to us. But you can still use them safely in children. It's all about the fit. There are child sizes and there's adult sizes that the extra small fits very well on kind of older primary school children. So feel free to use KN95s, but once again, it's all about the fit. So that's all I've got for you. Thanks.
I love that. I feel like I know I learned a lot, and I've been talking about masks for quite a while now, as I know many of us have been. So thank you, Courtney. That was awesome. I especially appreciate the demonstration. So Bryce, I know that we have a question here from an audience member that I'm hoping you can maybe tackle. So when we hear about side effects of the vaccine that could be the myocarditis, I think I got that one down right, and the pericarditis. No, maybe not. If these side effects present, are they, typically chronic conditions? Are they going to resolve? How can we think about this in relation to our kids and vaccines as they start to roll out?
Sure, it's a great question, and it's right in my wheelhouse. I love thinking about cardiac involvement in inflammation of the heart. So definitions: myocarditis is inflammation of the muscle of the heart. Pericarditis is inflammation of the sac that surrounds the heart. There are rare cases of COVID vaccine-induced myocarditis and pericarditis. It tends to be after the second dose of the mRNA-based vaccines, the Pfizer and the Moderna vaccines. It appears that adolescent males are at greater risk, but still, this is a vanishingly small risk. The symptoms, if you're worried about that, the symptoms that a child with myocarditis or pericarditis may have would include things like shortness of breath, chest pain, feeling that the heart is racing. These children who develop myocarditis and pericarditis do improve. It's a temporary condition. It's treatable with anti-inflammatory medications, and we don't expect long-term cardiovascular sequelae or poor outcomes in terms of their long-term cardiac risk. I would say that the other thing I would add is that this is not unique to these vaccines. We see myocarditis and pericarditis following a host of other vaccines. You don't hear about it because they're such rare events, but they're certainly reported to the Vaccine Adverse Events Reporting System, or VAERS, that tracks vaccine adverse events. So they're rare in terms of thinking of risk-benefit ratio. The benefit of getting the vaccine vastly outweighs this tiny risk of a treatable temporary condition.
Yeah, Bryce, I think what I saw a few days ago was, I've got to hear 63 out of every 1 million boys aged 12 to 17 had one of these events. And then there was a JAMA study, right? So median hospital stay was 1 day. So they come in, they're treated with non-steroidal medicines, pills, and they do pretty well.
And I think I read the median duration of symptoms was 4 days, just so you have kind of context for how significant of a complication this is relative to the, very long-term effects that we're seeing sometimes in COVID infection.
And death. Sorry to be blunt, but COVID causes mortality.
Thank you all for sharing all of that and answering that question. And, of course, we'll continue to encourage MPA community members to post any questions that we have here for the time that we have left. So, one thing that I've heard a lot, and I think we had a kind of a similar question to this, just wondering, what can parents expect as far as the logistics around vaccine rollout for their kids? So, I think earlier we mentioned perhaps the Pfizer is going to come out. Will it be same dosages? What do we know so far about what might be different when we think about vaccinating our younger kiddos? I suppose maybe I should call on one of you. Oh, I just saw Courtney. Good job, Courtney. You go ahead and unmute. Why don't you take that one?
I'll start us off. I'm sure Bryce can bring me home, but I think that the big thing about this, one, it's a great question. It of course is the rolling. It's what a lot of us have been waiting on for months, and definitely we've been given we have a little candy trail right now, trying to get to Halloween, which I know a lot of us are hoping for. I will just kind of start with dosage. So it is a different dose. That is not uncommon for vaccines, that, in presumed adolescents or adults, that they have one dosage, and then children will have a different. Even infants will have even sometimes a smaller dose than our younger children. So that is true of this case. So in general, the adults it's 30 micrograms, if anyone cares for that. It's a third of that for the other what we're studying now, which is 10 micrograms. So it's a third of the quote unquote dose. The most important about it's not the dose, it's about the immunogenicity, what's happening in the body. And what we have found, and with Pfizer's data that has just been sent to the FDA this past week, is that they are finding that they want to find the effective dose at the lowest dose. Once again, trying to rule out, is there going to be more adverse events with higher dosing, which is possible. So what they have found with a third of the adult dose, that they are seeing in children in this age group of 5 to 11, that they are seeing the same response, robust immune response, of saying, I see that virus, my body is making the good antibodies to help me downstream, that when I ever come in contact with it, that I sure hope I'm going to have expect to have a much milder course, if any. And so I think that's really beautiful, and we're excited. We had over 4,600 children that were started in this Pfizer that were under 12 years old. Now that does include infants, and they're not going to be published for probably till the end of the year. But we had a really nice showing of children who were in this phase 2 and 3 trial, and the data is looking good. I'm so excited because the FDA is looking at it right now. We don't know if it's going to be an emergency use. As the adults, we are hoping for it. We sure are hoping for it, because that changes your time frame, and that's where you get the Halloween. Usually with emergency use, you're looking at a minimum of 2 to 3 weeks after they've designated an emergency use authorization. Typically, it's about 4 to 6 weeks for many others, as we've seen in the past. So you really are looking at the end of October being the probably very earliest that we'll be able to see a rollout. But I think more to come, more to hear about in the next 1 to 2 weeks, as the FDA is going to turn this over quickly, at least to give us some information of what's to come. So.
Jennifer, I could add too. I think what we've heard from the state and from the healthcare providers is that we don't. I guess this is this is probably more relevant to the booster discussion. We don't anticipate a shortage of the vaccine, and so I think we're hopeful that the manufacturers can get those smaller vials ready for those little kiddos with that smaller dose that Courtney was talking about. We're going to have the vaccine, and I think that it sounds like the healthcare systems, CVS, Walgreens, and the state are all going to be sort of ramping up the vaccination clinics again if needed, so that we can get the doses out as soon as people are ready to get them.
That logistics piece is super important too, right? For parents as we start to gear up and plan for that. So we have an interesting question in the comments. I really have no idea. I don't know if any of you've seen anything about this, but is there any research that's supporting that perhaps antibodies from breast milk, so breastfeeding mothers who do get that vaccine, is that something that they're maybe helping to pass on, or does that ever happen with vaccines like this?
Yes, for sure. There's both transplacental passage of antibodies, meaning from mother to the fetus in utero. That happens, and so if you've been vaccinated and become pregnant or are vaccinated during pregnancy, the antibodies that the mother generates will be transferred to the infant. And similarly, it's likely that antibodies are appearing in the breast milk and getting into the nursing child that way. So yes, I think a challenge there is I don't think we have a good sense of how much protection they provide because the rate of symptomatic infection in infants and toddlers is so low. But based on fundamental immunology, I can assure you that the antibodies are getting into the nursing infant.
I would also just say that we do know that pregnant women are at increased risk of severe complications of COVID. So it is recommended that you get vaccinated during pregnancy.
Thank you both for that.
Before pregnancy, all of those things, right?
All of the above, huh? Yeah, going back to that important point that I know I've heard all of you talk about with the ways that the vaccine is impacting us and will continue to impact us societally and as a school. So I know we have a really great question that we're not going to have time on, but I do just want to put a plug in here on behalf of MPA. We've got Karna who's mentioned or sort of asked, what is going to change at MPA within our walls in terms of mitigation and the rollout once that 5 to 11-year-old age range kind of has vaccines available to them. And so just know behind the scenes planning is happening. We are working towards that, and we'll definitely communicate out to the broader MPA community about what is going to change and when and how once we reach that milestone. So more to come. And of course, the quicker we can get to those same high vaccine rates, right, that we've seen in the older populations at school, then the better that's going to be for all of us. So, just want to turn it over to each of you for any final thoughts. Emily, anything, maybe I'll start with you that you want to share here as we wrap up?
I just want to say thank you to the MPA community for being so supportive during the last 2 years almost now. I had people dropping off N95s that they had in their closet on my doorstep when I was scared, honestly, very scared that I was going to get infected and bring it home to my family and my parents. And you guys all stepped up. And I have continued to be in a great environment when sometimes, the days are long and tiring. And so the MPA community really has rallied around being strong during all of this. And I just want to say thank you for that. Also, thank you for those N95s, but feel free to use them now because we have lots. So go ahead and do it. It's payback time. You're worth it. So thank you for giving them to us though, because I do credit them. I have been, this far away from people coughing all over me and have not managed to get COVID. So they work. So there's my summary.
That's great. Thanks, Emily. Bryce, how about you? Anything, kind of a final thought you want to share?
I would echo what Emily just said, and personally thank you, Jennifer, for being so organized around this topic and taking the lead, putting together the committees that have dealt with this, being transparent with families about how things are proceeding. I see children from schools all over the state and the surrounding area, and I can tell you that Mounds Park's approach is superior to any other I've seen. And it's events like this and all the other hard work that you and your team have done that that is paying off in terms of low transmission, keeping our kids in school. And so I'm grateful to you for all the work you've done.
I promise that was not a plant, everybody in the audience. I did not know he was going to say that, but thank you, Bryce. And I think it's taking all of us, right, in our community to make this possible. John, anything you would want to share as we wrap up?
Well, I really love Carter's question. That's some of the most interesting discussion happening now around this stuff is about, unwinding what we've wound up or about off ramps. People talk about off ramps. So, Bryce talked about how this virus, it doesn't look like we're ever going to be rid of this virus. It's going to become endemic. It's going to be something that we learn to live with, and hopefully with enough immunity in the population, it's not something that is, it's not going to be this disruptive forever, but how do we get there? What are the off ramps? And then I really, when we hear about boosters in the news, I think we're thinking about that a lot, and it's important for the people that those are really recommended for to get them. They're open to all of us as healthcare workers, and I'll certainly get mine when my turn comes up. But it doesn't change the fact that getting a first and second vaccine dose into someone who hasn't gotten it is going to have a much bigger impact for a community than getting a booster to somebody who's already been fully vaccinated. So if you have, people in your world that you can talk to about vaccination, you can try to do that. And I know if anybody had questions in the audience and wanted to track one of us down, we would all be happy to talk about it as well.
Yeah, I can vouch for that. They're all still taking my phone calls, which is pretty amazing at this point with all of my questions that I have. So, Courtney, how about you? Anything you want to share?
I would just say from a pediatric side, I will always say there's, the best job in the world is to be a pediatrician. And that is still the case even through this pandemic. Bryce knows me. He feels me. We are taking care of the best part of who we are as humans. We're taking care of the best part of society. And I echo that, saying that that's what we're talking about today in this webinar is we're taking care of children who ultimately do take care of society. So it's one of those things that I just say, thank you. Thank you for the respect you've shown through a very, very difficult time for all of us, including our own loved ones, day in and day out. When there was 1,000 variables when this all started and so much information flying at you in a community, to bring it back together through hardship and saying, I trust in my community, I trust in MPA that we are trying to do the very best for, once again, the most precious, and how that only elevates all of us by doing that. So last plug-in for your influenza vaccines, go get them. It's here. I hate it, but it is. And just know that in the time of the next several months that we are going to be in a respiratory season for our children throughout the rest of cold season. And so, yes, it started very early for us. And yes, it's going to continue to do all those things that you always graciously do anyway, washing your hands, masking in public, masking at MPA, and taking care of each other, meaning calling out when you're having symptoms and doing the right thing for not only yourself, but your family, but also us as a community. So I say thank you for your time, and so grateful for MPA and the family that it has entrusted us to be a part of. So hope you have a wonderful night.
Oh, Courtney, thank you. And thank you, Emily, Bryce, John, all of you. You've just been phenomenal. I don't know that I could wrap up with a better ending point than what one of our commenters shared. Eric said, all of you and your healthcare colleagues are rock stars. So thankful for your work and dedication. There's no way to say thank you enough. I just want to echo that. Thanks for your time tonight. Thank you to our audience. As always, we will continue to share information, best practices, and resources in every way we can. Hope to see all of you again soon. Thank you, everybody. Have a great night.